I'm Dr. Adam Murphy, and I'm a urologist at Northwestern University and Jesse Brown, VA. We're going to talk about urinary dysfunction after prostate cancer treatment. Urinary dysfunction encompasses both urinary incontinence, which can range from some occasional leaking to complete loss of bladder control, and irritative voiding symptoms or urinary bother, including increased urinary frequency, increased urinary urgency, and pain upon urination. Obstruction of the bladder by an enlarged prostate is a typical reason for these symptoms initially. However, after therapy, these symptoms are typically caused by damage to the pelvic floor nerves and sphincter muscles used for urinary control. For men undergoing the surgery, prostatectomy, incontinence is one of the primary urinary side effects. On average, about 25% of men report frequent leakage or no control and a need to use absorbent pads at 6 months after treatment. By 3 years, fewer than 10% report using pads at all. Up to 30 to 50% of men with normal baseline function will report some increase in urinary symptoms and urgency after prostatectomy. External beam radiotherapy can also irritate both the bladder and the urethra, causing inflammation or swelling of the prostate. Most of the symptoms lessen over time with little or no intervention. Nearly 45% of men report irritative voiding symptoms after 6 months, and the majority resolve by 1 year. However, the symptoms can persist in some men, with less than 10% of men still requiring pads after 3 years. Up to 20 to 40% of men with normal baseline function will continue to experience an increase in urinary symptoms. Urinary dysfunction following brachytherapy tends to be more severe initially. Over 70% of men have symptoms requiring pads or medications within 6 months after seed implantation. But the rate drops to 25% or less after 2 years and to under 10% by 3 years. However, 20 to 40% of men with normal urinary function at baseline will have persistently increased urinary symptoms 3 years after receiving brachytherapy. Some form of urinary dysfunction is normal following initial therapy for localized prostate cancer, but it's important to realize that not all symptoms are normal, and that some require immediate care, including blood in the urine, persistent or urgent urination, or inability to empty the bladder completely. Continuing to work with your urologist to optimize your urinary function is an important part of your ongoing care.